Hello, dear students. We wish you success in the new academic year. And the topic of our lecture it is periodontitis in children, etiology, pathogenesis, and clinic, diagnosis, and different periodontal syndromes in children. Periodontium is a complex of morphological and functional interconnected structures surrounding the tooth and holding in them alveoli. Classification of periodontal of disease in children. This topic is very difficult, and you should write your synopsis and classification very long and difficult in some clinical aspects. For example, gingivitis have three forms. It is catarrhal, hypertrophic, and ulcerative. And course of this diagnosis, it is acute, chronic, exacerbation, and remission. Prevalence, localized and generalized. And about periodontitis, course it is chronic and a period of exacerbation, including abscessing and remission. Degree of severity, mild, moderate, and severe. Periodontitis and a rapidly progressive aggressive periodontitis, medium and severe. Periodontomis, epilepsy, hormonal hypertrophy of the gums, and symmetrical fibroma, hereditary hypergum disease, and periodontal syndromes in systematic diseases. The causes of the development of periodontal diseases are divided into local and general, and this division is conditional because the etiological factors can be closely and related to each other and to the general state of the child. The leading role in the development of inflammation in periodontal tissue belongs to infection. However, the bacterial model of etiopathogenesis of periodontal diseases should be considered in complex with specific individual reactions in the human body and other negative local action. For example, soft dental deposits are instrumented loose with grayish while or a yellowish mass which is loosely adjacent to the tooth surface. It consists of microorganisms and a mixture of cellular proteins. So bacterial structure of the deposits is varied. It is calci, it is rods, fungi, and ectomycetes. So dental plaque or biofilm is located above or below the gingiva. And I want to repeat about the formation of dental plaque is the result of content laying of the new microorganism. A periodontal pathogenic microorganism of soft subgingival dental plaque are combined into certain complexes that play a leading role in the development of inflammatory and destructive process in periodontal tissues. Complex first is formed by the bacteria Porphyromonas gingivalis and Treponema denticola. And complex number 2 is mainly formed of Prevotella intermedia and Prevotella nigrescens. So the nature of the influence of microorganisms of dental plaque on periodontum is very versatile. So, for example, gingivitis is an inflammation of the gums caused by adverse effects of the local and general factors. So, form we said on the previous slide about catarrhal hypertrophic and ulcerose. And of course, it is acute, chronic, exacerbation, and remission. About difficult of the process, it can be light or medium or heavy. Some dental cases. First case, it is acute catarrhal gingivitis, and here you can see that gingival papillae and gums are swollen, hyperemic, and bleed easily. This condition of the gums occurs is most infectious and viral diseases of the child. Acute gingivitis and submandibular lymphadenitis and often preceded and accompanied by acute herpetic stomatitis, progressing to ulcerative gingivitis in the prolonged and severe course of the diseases. And catarrhal gingivitis may persist for 10-12 days. The second case, it is chronic catarrhal gingivitis of pubertal age and exacerbated by poor or oral hygiene. You can see the soft plaque and inflammation of the gums. The child is 14 years old and have a permanent bite. For example, mineralized dental deposits, supra or subgingival dental calculus or tartar also provide the negative influence of the condition of periodontal tissue. Yes, we speak about this on our lessons. And the third case, it is chronic catarrhal gingivitis, and the degree of involvement of the gums in the inflammatory process. Here we use test of Schiller and Pisarev. And after lubrication of the solution, areas of gums with chronic inflammation are painted on dark brown color, and the amount of which increases have inflammation. The next case, it is chronic hypertrophic gingivitis in adolescents, and inflammation and hyperplasia of the gums in adolescents. Gingivitis cause the presence of the false gingival pocket. Okay. Next one is chronic hypertrophic gingivitis of adolescents, and here during the formation of hormonal status, you can see here very phenomenon of gingival hyperplasia. Yes, and majority of extragen in patient. And ulcerative gingivitis of Vincent. Please look. You can see very hyperemic and swollen gingival, and gray plaque on the gums, and very pigmented plaque, soft plaque, because in this situation patient is brush of toothbrush is very painful for patient using of toothbrush. And periodontitis is an inflammation of the periodontal tissues. So the main symptoms of periodontitis, it is connection of the gums with the teeth is destroyed, and the destruction of the jaw bones develops. So as soon as periodontitis begin to progress, there is bleeding of gums and swelling of the gums increased formation of tartar or calculus. If you do not treat periodontitis at this stage, you will have bad breath. And in the future, there are pockets in the gums between the teeth. In most cases, between gingival pockets are filled with various dental deposits, hard or soft. Diagnostic of periodontal diseases include the following stages. First stage is questioning, and next one is objective examination of teeth and periodontal tissues and oral mucous membrane. And next one, it is rentgenologic X-ray examination. So during questioning, it is necessary to pay attention to patients' complaints and their nature and duration. For example, it is bleeding, pain, changes in size, and configuration of the gums, bad breath. In case of periodontal disease in children, special attention should be paid to the presence of somatic disease, because destruction of periodontal tissues at young age may be a marker of pathology of internal organs and systems. And advanced study of periodontium includes the following stages. First stage is assessment of gingival mucosa, and here we should examine it color, size, configuration level of recession, and determination of gingival bleeding index during probing, and determination of the depth of the gingival and periodontal pocket if patient they have, and determination of the degree of loss of attachment, a degree of pathological tooth mobility, of involvement of the furcation into the pathological process. Next one, it is assessment of state of the oral hygiene. For example, presence non-mineralized or mineralized dental deposits. And of course, we should do an X-ray examination and providing all the microbiological research of the pocket's content, if it is necessary, of course. Localized periodontitis, it is inflammatory and dystrophic process in the periodontium of teeth with inadequate lot, open bite, you can see, orthodontic pathology, and teeth close only on molars. So sagittal slit, here it is 10 millimeters. Localized periodontitis, crossbite, look please here. Also orthodontic pathology, periodontitis and tartar deposits in the area are unevenly. Yes, and on the side of the physiological ratio of the teeth, of the upper and lower jaws, gingivitis is absent. Anomaly of attachment of the bridle of the tongue and small orifice of the mouth, such as connection of the mucosa with the bone skeleton, creates a risk of damage of the gingival papilla and the development of periodontitis. And when biting and chewing food, the gum tissue moves on to the edge of the dorsum. I want to speak with you about index of bleeding of interdental papilla. Probing of dentogingival sulcus is performed of the lingual surface of the first and third quadrants and on the vestibular surface of the second and fourth quadrants. Initially, the parameters of each quadrant are defined, and then the average value for the whole dental row is calculated. The results are assessed during 30 seconds after the probing and by the following criteria. So we have 4 degrees and 0 degree teeth bleeding is absent, 1 degree appearance of separate point bleeding. The second degree, the presence of numerous pinpoint of line bleeding. The third, it is filling of the interdental gingival triangle with blood. The 4 degrees, the appearance to intensity bleeding. And then you calculated the codes and have interpretation. So gingivitis is an inflammatory process in gingival mucosa and which isn't accompanied with the loss of integrity of the dental-gingival attachments, where necessary information. So with the loss of integrity of the dental-gingival attachment. Next one. Localized periodontitis, the inflammatory dystrophic process in the periodontal of the lower front teeth, is expressed. Inflammation of the surrounding tissues and bone atrophy, very large number of tartar. Periodontitis in the area of the lower central incisor. Please look. Hyperemic and bleeding gums. Localized periodontitis also. So lack of the space for teeth in the dentition. Also you can see dental deposits. You can see orthodontic anomalies, yes. And tight position of the front teeth of the lower jaw. Generalized periodontitis. Periodontal disease is characterized by inflammation of the soft tissues of periodontal and progressive destruction of the alveolar bone. Okay, so at the generalized periodontitis, the following radiological changes of bone tissues are defined. You should remember this information because we can see expansion of the periodontal gap and osteoporosis of the intercellular septum, destruction of the cortical plate of the alveoli, and a vertical or horizontal or mixed resorption of the alveolar process, and the prevalence of a bone pocket. The degree of their severity corresponds to the severity of the destructive pathological process in the periodontal tissues. Mild generalized periodontitis is often asymptomatic, only with the exacerbation of the process. Children complain of pain in the gums and they are bleeding. And a mild generalized periodontitis is characterized by the following changes. This cortical destruction plates of interalveolar septum, especially in the apex, and expansion of the periodontal gap in the necks of the teeth, insignificant resorption of tops, and the presence of foci of osteoporosis. Generalized periodontitis, please look. Mild and look please. So, generalized periodontitis is a disease characterized with inflammation and progressive destruction of the periodontal tissues. In children, it can be caused by prolonged chronic course of gingivitis, usually on the background of somatic diseases. So, repeat, please. For generalized periodontitis, following clinical signs are typical. It is symptomatic gingivitis, the presence of periodontal pockets, then pathological tooth mobility, and secondary traumatic occlusion. And clinics. Children complaints of itching, insignificant pain, and bleeding of gums during brushing or eating of hard food and a bad breath. Generalized periodontitis of mild degree often has an asymptomatic course or is characterized by unexpressed clinical symptoms. So only in case of aggravation of the process, patient complains of sense of burning and pain of gingival bleeding. Objective examination reveals signs of chronic asymptomatic catarrhal gingivitis, along with the inflammation of the gingival mucous periodontal pockets are diagnosed. So their depth in case of a mild severity degree does not exceed from 3 to 3.5 millimeters. Pathological tooth mobility within 1 millimeter. It is necessary to differentiate the generalized periodontitis of mild degree with catarrhal or hypertrophic gingivitis. Distinctive clinical signs of periodontitis are: it is destruction of dentogingival junction, loss of integrity of the epithelium of dentogingival sulcus, and its ingrowth into the forming periodontal pockets. For determination of the final diagnosis, it is necessary to use X-ray examination. In case of self-induced chronic gingivitis, the osteoporosis of tubes of septa without loss or of integrity of cortical lamina or alveoli is possible. And in case of generalized periodontitis of moderate degree, the depth of periodontal pockets increase up to from 4 to 5 millimeters, and pathological tooth mobility of 1 to 2 degree. It is within 1 and 2 millimeters develops. As a result of their dislocation, secondary traumatic occlusion is formed. And radiography reveals widening of periodontal tissues. It is destruction of cortical lamina. It is unequal resorption of spongy substance of interdental partitions up to 1.5 of root length, and osteoporosis in present areas. And it is clinical cases. Generalized periodontal leads of the formation of gaps of moderate severity of bone pockets, and generalized periodontitis of moderate severity, decrease on the interalveolar partition within 1 and 3. Please look on here. We should see interalveolar partition, and in this case it is loss of 1 and 3 of its height, and distraction of the cortical plate on top of the intercellular practitioners. Also, generalized periodontitis and reduction and reduction of the interalveolar septum by 1 to 3. Or here we should look septum. For severe generalized periodontitis is characterized by the following symptoms: diffuse catarrhal or hypertrophic gingivitis, periodontal pockets over 6 mm, pathological mobility of teeth from 2 to 3 degrees, and severe traumatic occlusion. Reduction of the interalveolar septum within 1.5 and normal level, and diffuse osteoporosis. Here look please, and normal level. Periodontitis is a chronic and long-term inflammatory process in the periodontium, the clinical picture of which is determined by the symptoms complexes characteristics of various forms of gingivitis. It is periodontium pocket and defect of bone and gums. With periodontitis, in contrast to gingivitis, the radiograph shows clear destructive changes in the bone tissue of the jaws. Local causes of periodontitis include tartar deposits, abundant reproduction of the oral microflora, microbial plaque, overload or insufficient functional activity of certain groups of teeth, congenital and squads deformities of the jaws and mucous membranes of the oral cavity. And a rapidly progressing periodontitis, forms of periodontitis with an atypical course, caused by microorganisms capable of penetrating faster and stronger into periodontal tissues, which have some pathogenic properties. This diagnosis occurs in young people. In the development of the diseases for following anaerobic periodontal pathogenic microorganisms are dominated here Actinobacillus actinomycetus and Prevotella intermedius, Fusobacterium nucleatum and Veillonella recta and Porphyromonas gingivalis. Attention is paid to expression of inflammation in the periodontal tissues. So rapid destruction of connective epithelial attachment and activity of the destructive changes in the bone tissues of the alveolar process and the tendency to aggravations. Clinical pictures of aggressive periodontitis and very deep pockets. Teeth are mobile and rotated along the axis and a state of disocclusion. Panoramic radiographs of the jaws of adolescents suffering from an aggressive form of generalized periodontitis. Blue, please. These defects. And aggressive form, clinical picture. The area of the central and lateral incisors of the upper jaw, deep pockets between the central and lateral incisors, and their second picture, also deep pockets between the incisors, and granulation tissues. Panoramic radiograph of the jaws. So here you can see a bone destruction in the area of distance lower molars. Please look. Arch defect, yes. These defects was formed during the formation of aggressive localized periodontitis, and these are removed due to severe mobility. And pay attention to the nature of bone destruction. Dental radiograph of the aggressive form. Periodontitis, a group of periodontal diseases, includes all neoplasms that originate from periodontal tissues of bone behind and malignant nature. And gum fibromatosis and epulis. So it is benign tumor-like growth of soft tissues in the area of alveolar process of the jaws and occurs due to prolonged irritation of the mucous membrane and hormonal changes such as osteodystrophy. And I want to speak with you about the treatment of generalized periodontitis. It should be the complex and including general and local methods. So prescribing of general therapy depends on the presence of general somatic diseases in children. And sometimes we need to work together with a pediatrician, yes, and endocrinologist and other specialists. So local treatment of generalized periodontitis, it is professional oral hygiene, antibiotic therapy, anti-inflammatory therapy, and hygiene education, control of hygiene skills, and recommendation for the choice of hygiene equipment and products for oral hygiene, and removal of local predisposing factors. And of course, it is a supportive therapy every 3 and 6 months. It is generalized gums fibromatosis and deciduous teeth and symmetrical fibroids of the upper jaws. Look, please. Features of the course of idiopathic diseases with progressive lysis of periodontal tissues. Of course, it is development of the diseases in early childhood. The progressive course ends with the loss of teeth. The pathological process is localized in the alveolar process and other parts of the skeleton, as well as in the organs involved in hematopoiesis. And idiopathic diseases with progressive lysis of periodontal tissues, it is very difficult topic. So of course idiopathic diseases are characterized by expressed inflammatory process in the soft periodontal tissues, fast loss of attachment and formation of dentoepithelial periodontal pockets. It is progressive osteolysis of alveolar process, significant pathological tooth mobility, tooth loss and tendency to aggravation and abscess formation. Such changes usually have genetic basis and are considered as periodontal syndrome. For identifying of idiopathic lesion of periodontal tissues in children should be carefully examined by pediatrician, endocrinologist, and other specialists. And here you can see different syndromes. For example, periodontal syndrome in case of decompensated insulin-dependent Diabetes of this first type of diabetes is characterized by aggressive type of course with tendency to relapses and aggravation. These clinically initial signs of lesion in periodontal tissues are expressed bleeding, hyperemia, and considerable cyanosis, swelling of gingival mucosa, as well as tendency to hypertrophy. The presence of such clinical symptoms, especially during period of deciduous dentitions, requires special attention and complex examination of the child. So, next one, it is periodontal syndrome in case of hereditary neutropenia is rare and characterized with decrease of the number of neutrophils in the peripheral blood and bone marrow. And the cause of the diseases is hereditary deficiency of enzymes. And it is Gaucher's diseases and characterized by the accumulation of cerebrosides and kerosene in the reticular endothelial cells of the liver, spleen, lymph nodes, and lungs and bone marrow. And acute form in children under 1 year of age and ends with the death of a child. And chronic forms, thick children older than 10 years. So here can be remissions and intermissions, anemia, enlargement of the spleen, liver, lymph nodes, leukopenia, thrombopenia, and bleeding. Pain of the joints, bones, manifestation of oral cavity, and proliferative changes of the gums, tooth mobility, pathological pockets, presence of exudate. On the X-ray of the jaws, we can see osteoporosis and reducing of thickness of the compact plate. And Schuller-Christian disease. Here you can see 3 periods: initial period and significant changes, and features these defects in the bones of the skull, diabetes mellitus, axophthalmos. In the crook second, you will have such questions. In the mouse, generalized catarrhal gingivitis, ulcerative necrotic changes, yes, and deep pathological pockets. So, exposure of the neck and roots of teeth, moving teeth. The gingival margin, neck and roots of the teeth are covered with orange-yellow layers. X-ray, these areas of destruction of round or oval shape of different localization. And xanthoma cells, period of remission from 3 to 4 years. Non-lipid reticular dystosis and chronic form. Here, general clinical signs and clinical sites in the oral cavity. Look, please. Eosinophil granuloma, terratino disease. So it is occurs mainly in children of preschool age. In adolescence, it occurs more rarely. However, for first time, the disease may appear in infancy before the eruption of the deciduous teeth. And clinics, there are 3 clinical forms of eosinophilic granuloma. It is local, diffuse, and generalized. Local form characterized by development of tumor-like infiltration in distant form from alveolar process areas of body of the lower jaws or its branches. At the same time, symptoms of expressed inflammation and other pathological changes in periodontal tissue are absent. Diffuse form develops in the alveolar process and gradually spreading to the body and to the ramius of mandibula. Usually the process is localized in the area of lower molars. More rarely, it affects the same area of upper or lower jaws. And the moderate leukocytosis are expressed eosinophilia, which reaches in 10 or 15%, are found in the peripheral blood. Treatment is complex and provides, together with a pediatrician and hematologist, and on X-ray it is sequestration of the rudiments of permanent teeth, osteolytic defects of the alveolar process of the body of the jaws, and periodontal syndrome. It is X hystestosis. Distinctive features of periodontal lesions are generalized lesions of skeletal bones and including jaws. So rapid progression of pathological changes, signs of ulcerative necrotic gingivitis and periodontitis, loss of teeth and deep pockets. And general symptoms: lymphadenitis and exophthalmos, polyuria, changes in skeletal bones, especially flat, skin rash and weight loss. On X-ray, ulcerative necrotic process and destruction of the bone. So granulation, yes, deep pockets. And X-ray, bone destruction in the area of the alveolar process. Please look, very thin layer of jaw in the second deciduous molars and including the bone around the rudiment of the permanent tooth. Periodontal syndrome also, it is sagittal X-ray of the skull and neutropenia. It is agranulocytosis. So permanent, it is complete absence of neutrophilic granulocytes. And cyclic. Neutropenia, it is periodic absence of neutrophilic granulocytes. Is rare and characterized with decrease of the number of neutrophils in the peripheral blood and bone marrow. And the cause of disease is hereditary, so of enzymes, don't have enzymes. And clinically appears from the first months of life in the form of pustular skin lesions and furuncles, abscesses of hypoderma, and blepharitis. Purulence process often develop in the lungs. Eruption of temporary teeth is accompanied by the appearance of ulcerative necrotizing gingivitis, which is replaced by generalized periodontitis in the age of 2 to 3 years. And very aggressive course as a result of progressive resorption of bone tissue of alveolar process. Progressive gingivitis, pathological pockets, tooth mobility, tooth loss, general violations, it is pneumonia, otitis, and hepatitis. Inflammation in the blood, and periodontal syndrome with persistent neutropenia. It is a child 40 years old, generalized atrophy of the gingival margin, despite the pronounced dystrophic process in the bone, and deep gingival pockets and movable teeth. The gums are pale in color, and inflammation is almost absent. And blood tests: panoramic radiographs of the jaws of children with cyclic and persistent neutropenia. So note the uniform atrophy of the bone, and children age 12-14 years, dental caries, and apical periodontitis is absent. And acute agranulocytosis causes, it is detrimental effects of the hematopoietic organs of drugs, ionizing radiation, and allergic diseases. And manifestation of the disease in oral cavity, it is catarrhal gingivitis, which ends with ulcerative necrotic and gangrenous process. Also deep gingival pockets, teeth mobile, necrosis. Periodontal syndrome in insulin-dependent diabetes mellitus. So the initial signs are severe bleeding, redness, and swelling of the gums. Its tendency to hypertrophy. And on these pictures you can see periodontal syndrome in children 14 and 16 years with diabetes. Teeth are mobile, calculus deposition, granulation, and pockets. Panoramic radiograph of the jaws of teenagers suffering from diabetes. Destruction of the alveolar bone. Please look. And Papillon-Lefevre syndrome. It is palmar inflammatory dystrophic process, and it is a disease caused by disorder of metabolism of tryptophan, and it is autosomal recessive type of inheritance and combined with palmoplantar dyskeratosis. And signs of the disease are manifested in deciduous teeth, so the disease affects symmetric areas of palms and soles, and sometimes it spreads of dorsal surfaces of hand and feet, or even further to elbow and knee joints. The lesions of skin have accurate purple borders, and they are demarcated from the healthy tissues. And on rhinological symptoms are characterized by lacunar type of destruction of alveolar bone in the area of molars and premolars, and in the area of frontal teeth there is more equal resorption of interdental septa. So treatment is symptomatic. Please soles and palms of the child with these syndromes. Thank you for your attention, and I wait for your synapses. Goodbye.